For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning, everyone. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Thanks for joining us. We will have folks available to answer questions or do interviews in other languages after the conclusion of the main part of the press conference. I did want to note that at the outset. I'm joined this morning by Dr. Sarah Cody, our Health Officer and Director of the Department of Public Health, along with President Cindy Chavez of the Board of Supervisors, and Michael Ballier, who is Director of Environmental Health and Director of the EOC's Business Engagement Branch. We're here to talk with you about two really important and interrelated issues. First, Dr. Cody is going to talk about a significant uptick in cases that we are seeing, and then I will speak about our work and efforts with respect to business engagement, outreach, and enforcement and compliance. Michael Ballier will also talk a little bit more about those efforts and the assistance that we're asking from the community in those efforts. But with that, I'll first turn it over to Dr. Sarah Cody, our Health Officer.
Thank you, James. Good morning, everyone. This morning, I am here to share some sobering news. Our case counts in Santa Clara County are starting to surge. Our patterns are beginning to look much like they look in the rest of the country, the state, and the region. I wanted to go over some of the data with you so you can really understand what's going on and share that information with members of the public. I think it's very important for everyone to understand where we are and what each and every one of us can do to better protect ourselves as we go into the holiday season. I am just going to go grab a visual to explain what's going on. So this is right off of our website, which you can all see, but I wanted to make a couple of comments. First of all, I wanted to note that we had this big surge in July. It didn't take long to go from very low levels right up to that surge. We then took action here and across the state, and our case counts came down, although you can see it took a long time. It was a slow drift down. The baseline that we achieved collectively, which was here, by the beginning of October, at least we were down to double digits from triple digits as far as average number of cases per day. But then you can see that over October, we began to drift up. And we've been tracking that drift up. And we've been talking about that drift up. But what's happened in the last week, it is no longer a drift. Our cases are surging up, and that is cause for concern. You can see here, right there, it's beginning to take off. Similarly, I want to share our hospitalizations. As you know, hospitalizations as an indicator lag newly reported cases, and we can see that in our own data locally as well. I want to draw your attention to the left side. Over here, much like our case counts, our hospitalizations came down, where we were trending around 80 patients per day in the hospital. That new baseline is no longer our baseline. It is also picking up. And over the weekend, we were over 100 people in the hospital. Whether that will stay, we do not know. However, this sharp uptick in cases is a very worrisome sign as far as what it may mean for our hospitals. So the question is, why is this happening and what can we each do? It is not completely clear exactly what is driving this sharp surge that we're seeing everywhere. It's possible that we are about a week plus out from Halloween. It's possible that we are all experiencing pandemic fatigue as we've been at this for a very long time, and there's a few other things that have been happening around us in the world. But the key take-home message that I really want to get across is that what each of us do every day really matters. And an increase in cases is both a risk for the health of our community as well as for the health of our economy. The way the cases are trending down, we are trending ourselves right into the red and potentially the purple tier of the state's framework, which, as you know, means a lot more restrictions. So this is a concern, again, both for health and for the economy. They are inextricably linked, and so each of us needs to do everything that we can, both in our personal lives as well as when we go and engage in any businesses. Thank you.
So picking up on what Dr. Cody was talking about, I want to talk a little bit about some of the things that we can do to help make a difference in addressing this sudden spike in cases. First and foremost, we all have our own individual and family responsibilities to continue to really be thoughtful and careful and consistent in following the risk reduction measures that have been put in place. That includes use of face coverings, maintaining social distancing, and making sure that we're really being vigilant, especially as the weather turns, especially as we enter a season where we all very much want to be much more engaged with family and friends. Second, it's all the more important now that we have vigilance on the part of our business community and for entities. We should all expect to see the orange check mark at every single facility where we enter. That means that that business has filed and submitted a revised social distancing protocol. It means that they have informed that their employees what to do and the precautions and steps to take. It means they've put in basic safeguards to keep their customers safe and also their employees safe. If you see concerns, if you become aware of violations on the part of businesses or entities or others, we want you to report those to scccovidconcerns.org. We have an online portal and we have a team that Michael Ballier is going to discuss a little bit further that follows up on each of those concerns. And it's an education first model. We have done a phenomenal job as a community coming together. And when we have done that initial outreach, we have been very successful, and Michael will talk a little bit more about that, but we've been very successful in our partnership with the EOC, the County Council's office, with the help and leadership of the District Attorney's office. We have been very successful in an education-first approach to helping make our businesses, open facilities, activities operate in a much safer manner. And that's really our goal here. And for those few small entities where we're continuing to see concerns after that education and outreach, we will do and have taken action. Why? First and foremost, because that's absolutely essential for keeping our community safe, for avoiding deaths and avoiding serious illness. But also, it's absolutely vital so that our whole county doesn't suffer the consequences of potential super spreader events or other increased disease transmission from the acts of a handful of entities that could be raising the level of virus transmission across the whole county and therefore result in closures, result in illness and death more broadly. And so it's for both those reasons that we're really vigilant and that we're paying a lot of attention to this. But we do need everyone's help. We do need it to be a community expectation and norm that everyone will only go places where they see that orange check mark, that where people do ensure that there is social distancing, that there is use of face coverings, and that we are all collectively remaining vigilant even these many months later into the COVID-19 pandemic. A couple other things that I wanted to just emphasize. On that same website, scccovidconcerns.org, you can also report any concerns around access to testing. We do have our enhanced testing order that I know we've talked about before. We have a lot more testing occurring here in the county. That's really good. But we are continuing to hear some concerns about access. And if you have those concerns, you can also report those the same portal as well. I'm going to now turn it over to Supervisor Cindy Chavez. Okay, great. I'm going to now turn it over to Michael Ballier, who is the head of our EOC's business engagement branch.
Good morning, everybody. Thank you for joining us today. Michael Ballier, Director for Environmental Health and the Business Engagement Branch with the Emergency Operations Center. I first of all just want to say thank you to the community for all the hard work that they have put in over these last several months. We know it's been extremely difficult. And I also want to acknowledge the great work of the teams in the Emergency Operations Center and in our branch for really going above and beyond in terms of assisting businesses in the community. We have a very robust operation that coordinates across multiple roles in the county, and those include different activities such as providing easy access to information. We have training videos on our website. We have a whole host of resources for businesses to learn how to implement these sometimes complex regulations and rules. We recently updated our web portal, the scccovidconcerns.org, to be more user-friendly and to also serve as a landing page for resources for both businesses as well as the general public. And as one option, you can file those concerns, as James mentioned earlier, anonymously, and you can provide your information as well. You have several choices available. Our team members have actually been scaling up this operation since mid-August, where we've been actively engaging the business community in an effort to really achieve a global understanding of these rules. We also continue to work with and understand that the vast majority of businesses out there are doing the right thing and want to do the right thing. Sometimes you just need a little assistance to understand what that means. We also continue to provide services directly in the community through our business engagement team, which I'll talk a little bit more about in a minute. What's really important to note is that compliance with the health officer orders is really important to ensure a safe experience for both customers and employees. You want to be sure to honor that business's requirements as you enter their location and respect what they have asked you to do to help protect them as well. The different operations that we conduct throughout the county and that are coordinated regularly include the outreach and education and communication with our PIO unit. It's the website, public service announcement, demonstration videos, the business call center, who has staff available to respond to questions from the business community. The engagement, and we have a business engagement team that's strictly educational, canvassing communities to provide information, resources, posters, social distancing markers, face masks, and a variety of other tools at no cost to that business. The engagement, compliance, and enforcement branch steps in when we have individuals or we have concerns that are filed on our web portal and where people are either unable or unwilling to comply. Typically, we respond to these by email, info, by phone, or in person, just depending on the severity of that violation. We may issue a notice of violation if we confirm a violation present, and we'll issue a notice of violation that would assess fines and penalties But many times those can actually be waived if you correct within a grace period, which can be anywhere from 24 to 72 hours, or for really severe violations may not be provided a grace period at all. I also want to acknowledge the great work of all of our cities, law enforcement, and the district attorney's office, who continue to be critical partners in helping us implement and ensure that the community and business owners are aware of and can comply with the orders. And I also just want to again say thank you to all of the team members who have been out there. We operate on the weekends, we operate at night, and oftentimes, sometimes late into the wee hours of the morning, depending on the situation. I also just want to express and just reiterate something that James said, which is patrons should really come to expect that businesses are complying, and they can actually view whether or not your favorite business has submitted their social distancing protocol by going to sdp.sccgov.org. And just to really highlight again that enforcement is really used for those more serious and willful violations, and for those businesses that absolutely refuse to comply for whatever reason. And so again, we just want to say thank you to the community, to business owners, and to everybody for their ongoing partnership in ensuring that we can continue to stay in the tier that we're in and enjoy the benefits that come along with it. Thank you very much. Turn it over.
Well, good morning, everyone. Let me start by saying that I know for the people who live, work, and play in Santa Clara County that you're kind of getting tired of the message. Wear your mask, wash your hands, stay socially distanced. And I agree with Dr. Cody that what we're probably seeing with these increased numbers is people just letting their guard down. But here are two things I just really want everybody to understand. One is that if we don't get our numbers to keep coming down, we are going to move up a tier, which will increase restrictions in our county. I want to say that again. As a community, we have to work together to keep these numbers down, or we're going to have more restrictions in our community. That's the first thing. The second thing is that in addition to wearing your mask and washing your hands, we need people to get tested. And I know a lot of people watching this are saying, I got tested. Why do I need to be tested again? We are making testing so easy because we know that if you get tested and you find out you're COVID positive, you're going to be able to protect yourself and your families. And you don't know it. You could have gotten it at a grocery store. You could have gotten it at work. So we want to know as much as we can about the risks out there. And then one other thing I just want to say, and I'm saying this to all of us who love our families, we sometimes think if we know someone, they can't give us COVID. I don't know why human beings think that, but when I've watched people do this, where they don't know somebody and they're more willing to put on their mask. But when they see someone, even if they haven't seen them in a long time, they touch them, they embrace them, they think of household as being everybody I know. That is not your household. Your household is the people you live with. The people you live with. Last thing, flu season's coming on. So in addition to wearing your mask, staying socially distanced, washing your hands, we want you to get COVID tested, and you really need to get a flu shot. Why? Because nobody wants our hospitals full of people who have the flu when we might need those beds for somebody who has COVID. And worse than that, we don't want you or anybody in your family to get the flu and COVID. I know we're asking a lot, and I know people are tired. But here's the thing. We're only going to get through this one way, and that is if we're working really hard, and we're working really hard together, and we recognize that this is not something that any one of us can do alone, but we're asking everybody in our community to dig in a little more, dig in a little longer, and get us across the finish line. So I'm really grateful that all of you are here, and I'm just going to ask if you all wouldn't mind printing where people can report, the sccovidconcerns.org, and remind people that SCC free test, in addition to your healthcare providers needing to provide this test, SCC free test is where you can go if you need a test. If you don't need insurance, we just need you to get tested. Thank you very much.
Hi everyone, we're now going to turn to the Q&A portion of today's press conference. To make sure that everyone's questions are answered, I'm going to be calling on folks to ask their questions. Our speakers will repeat the question, then provide an answer. I want to also remind everyone that we have PIO representatives on site to answer questions and provide interviews in Spanish, Vietnamese, and Chinese today. Questions? Right here, and then there.
Thank you. The question is, with the new cases, how can we describe them, and particularly by age? What I can tell you is that similar to the uptick that we saw in the summer, this uptick is also largely younger adults between the ages of 18 and 34. We're watching very closely, in particular, the 25 to 29-year-olds. And similar to other surges, there are particular communities in our county that are seeing a disproportionate share of cases. That includes East San Jose and Gilroy. But I want to highlight something very important, and that is this is a highly infectious disease. This virus doesn't care. This virus is not going to stay in one community. This virus is going to spread. That's what this virus does. And so it's not just about the communities that are seeing higher case rates. It's about everybody living in this county. And just like Supervisor Chavez so succinctly put, it's everybody's role, even if we're tired. And think about this. We may have that interaction that we've so longed for with someone outside of our household, and we unknowingly spread COVID in that interaction, and that could start a chain of transmission that ends up with someone who is older or frail and lands in the hospital or even dies. So even if you think, well, I didn't have symptoms and I passed it to somebody else that they didn't have symptoms, the issue is that it's sparking a chain of transmission, and that can lead to surges. Thank you. This is a question to readdress the significance of these case counts and the hospitalizations. What's significant about the increase in case counts that we're seeing now is that different than a slow rise that we've seen over the month of October, in the last week we've seen a steep rise, more like a surge. And that concerns me, and it concerns all of us, because it could mean that we're in for a large surge that will be difficult to control. We also know that when we see a surge in cases, it is almost always followed by a surge in hospitalizations. And so we are, as always, working with our hospitals to ensure that they also are prepared.
Dr. Cody, you mentioned the possibility that the county could move into the next tier. Is there any timeline if the rates continue to rise?
The question is about the timeline for the county changing tiers. The state reports every Tuesday the new data by county and the new tier assignments. So that will be coming out tomorrow. As you recall, currently the state framework is that if you move a tier, you can wait, and it's up to the locals. You can wait and stay in and not actually close things in the tier if you wish, or you can make a local decision to close more quickly. I just want to get out a little bit in front of this and say we're out here today to tell you that we're concerned. The rate of rise is the concern, and the earlier that we act, the safer we will keep everyone. We across the country are concerned about gatherings over this holiday season, both Thanksgiving as well as the many winter holidays. We urge people not to travel. We urge people to stay at home and celebrate with their immediate household. We also understand that after an extraordinarily difficult year, people want to come together and find some nourishment in the company of family and friends. We have guidelines for how to do that safely. Chief among them is to gather outdoors. I will tell you that for Thanksgiving, I am gathering with my mother, who is in her 80s. She will be outside, wrapped in blankets, greater than 10 feet from where I am. So that's one way to do it.
Is it okay to hug family?
You may hug family members that are in your household. You must understand that if you're with anyone outside your household, particularly if those household members are like me and are out and about for our work, those household members are a risk. And so coming into close contact, like an embrace, will increase the chances of COVID spreading.
If the county were to move tiers, do you anticipate making the call to close activities sooner than the state would?
The question is about if the county changes tiers, what will we do as far as timeliness? We are in discussions, and I want to say not just here in our county, but as a region. As you know, our cases track pretty much how the region tracks. So we have some very important conversations to think about what can we do together and on what timeline. Oops. The question is about schools and returning to a hybrid schedule. One of the many reasons that we have all worked so hard collectively in our community to keep our case rates down is to ensure that it's safe for our students and teachers to return to school. We don't know where these trends are going to go. What I can tell you now is over the last week, the rise has been steeper than it had been in the last month. Our goal, though, is always to do whatever we can to create an optimal environment for our kids to learn. And so I think it's too early to tell.
Can you tell if there have been people coming in from out of state or from areas that aren't as careful as we are here in the Bay Area? Can you contact trace to outside the Bay Area?
The question is about introduction of the virus from areas outside of our county. We know in our county that we have a very diverse population, and our population travels for business and for pleasure. I can't tell you about any specific trends that's been revealed through our contact tracing as far as from where. What I can tell you is that our cases, we're not an island. We're not protected from the rest of the state and the country as far as this virus. So when cases surge around us, they tend to surge in the county as well.
Is any plans for business so that traffic can help them because it's going to be a problem, right? And what can business do to help lower this?
The question is about what can businesses do to help lower rates of transmission. As Mr. Ballier and Mr. Williams described, we have safety protocols for businesses so that businesses can operate safely. We also have a website so that any patrons who are concerned about operations can report to us, and we can follow up with education. Our protocols are designed to enable businesses to operate safely so that the patrons coming to the business can be safe as well. And the vast majority do a fantastic job.
Cody, let's
I'll take your second question first, and then I'm going to hand it off to a colleague for your first question. The Bay Area health officers were actually issuing a statement today. I don't know exactly what time it's going out, and it basically encourages people not to travel and strongly recommends that if people do travel, when they come back, they stay home for 14 days. It is not a legal order of quarantine. It's a urging and a strong recommendation. The reason being that there's so much of this virus circulating, and the last thing any of us want to do is to bring it into our communities where it will spread further.
The question is, how many businesses have been issued notice of violation and fines? And what I can tell you is that we've received over 1,850 concerns through our portal. We've actually closed out 1,307 of those, so they've been resolved. And that's resulted in 79 notices of violation. Some people correct within the time frame, so this is kind of a rolling number. And we've issued dozens of what we call notices of fine imposition. I don't have an exact number for you, but I can tell you that we've assessed over $600,000 in fines so far, and we're actively in the process of collecting those.
Anything you want to say about the church that has been in continuous violation, and if someone were to apply for some kind of forgiveness of these fines, is there a process for that?
So I'll take your second question first and then turn it over to James Williams for comment on Calvary. There is a process. If businesses have been assessed fines, they can actually request a compliance agreement with the county to help reduce those fines. And so again, we provide multiple opportunities for businesses to cure the violation and the financial penalty, because I know the last thing anybody wants to do when businesses are struggling is continue to have to pay. But the reality is we have to have a mechanism in place that encourages good behavior. And as the vast majority of businesses out there already know, compliance with the orders also makes good business, and it protects your customers and your workers. James, we're going to comment on Calvary.
Yes, to comment on the cavalry situation, we're continuing to be in active enforcement. The Superior Court did issue a restraining order requiring compliance with the health orders, and we're continuing to move forward with further actions in order to bring them into compliance. You know, it's very disappointing to see this example. It's fortunately so far the only time we've had to go into court to seek a court order for enforcement. As Mr. Ballier mentioned, you know, we've had over 1,000 concerns, and almost all of those have been able to be resolved through education and outreach. And the several dozens that have had to go to formal enforcement, most of those have been able to be resolved pretty swiftly thereafter. And so this particular situation is really unfortunate, but the risk is quite significant, and because the risk is significant, and because we need to protect the community as a whole, including that congregation, we will continue to pursue vigorous enforcement of the health orders.
Two questions for Dr. Thanks again. This is from Maureen Naylor, so I'm going to read it. Are you seeing any trends or clusters of how people are getting COVID-19?
The question is how people are getting COVID-19. We don't have at this point any clear signals of particular groups or subpopulations or clear super spreader events that would explain the surge. We are actively investigating to understand whether there may be such events.
Next part, have we seen a steep decline like this before, and how does it compare to the big picture?
The question is, have we seen a steep increase like this before, and how does it compare to the big picture? Yes, in, the graphs are speaking, they're answering the question, and the answer is yes. In July, we saw a sharp uptick in our case counts and our case rates. And then in October, we saw a gradual drifting up. In the last week, the rate of change has been very steep, and that is the concern. We've seen this before, and it got us into trouble.
Do you think, I mean, we're reminding people, like Cindy said, hey, keep doing what you're doing. And every time, is there any pattern that we can remind people when you have an uptick like this, does it go down? Do you see that? In terms of, you know, if I'm looking at the chart, up, down, obviously we got, you know, every time it spikes.
Yeah.
Does it work?
The question is, do these press conferences work? Of course they do. No. Yeah. I don't know, Supervisor Chavez, maybe you could give your thoughts.
Yeah, thank you. You know, I think it's such a good question because I think the short answer is there's somebody at home right now who's thinking maybe I wasn't as careful, maybe I need to keep washing my hands, maybe I need to rethink Thanksgiving. That's what the point of today is. I think that where we saw a decrease was really because this is just my own perspective, just looking at our county. One, I think that the health orders that the Dr. Cody set out early on helped our community right away take this seriously. So I think that was really important. And then the second thing is that, and I think this really helped, is that right away what the county did on our own was, in addition to what the state and federal government were doing to educate people, we right away put in a system where we were speaking to people in multiple languages in their neighborhoods. Now remember, Santa Clara County, that we have that over 50% of all of our households speak a language other than English at home. 50%. We have almost 40% of the folks who live here that are foreign born. And so what that means is that we live in a place that's very complicated to communicate. So I think all of that helped. Me, the least doctory person up here, I'll just tell you as an average person, here's what I know. I know that when I'm looking at family and friends on Facebook that I'm sending them notes saying, seriously? Seriously. And that's why we're having this conversation, so that all of the people who are watching today can reach out to their family members and say, let's live a long, happy, prosperous life. Let's get through the next really 6 months, a year together, and let's come out on the other side, everybody healthier, everybody stronger. So that's why we do this. Maybe it's to make me feel better as a mom. I'm wearing my mom hat as a county mom. But my belief is that we've really got to communicate with everybody and remind people and refresh people because they're tired.
The question is about travel and quarantining upon return. I would just echo the comments of Supervisor Chavez that we really are all in this together and our fates are intertwined. And the lower we can keep the case rates, the more we can protect people's health and the more we can protect our local economy. And both are really, really important. We can urge people, and we do urge people, to not travel unless it's absolutely necessary, and in particular to not travel to places where there are higher rates of disease transmission than we have locally in the county. If people do travel because it's essential and they absolutely have to do it, we urge them to self-quarantine for 14 days when they return, as well as to watch for symptoms in themselves and in household members, and to get tested frequently, particularly if they may have been exposed. Testing doesn't doesn't prevent you from getting infected, but it may prevent you from spreading your infection to somebody else. This is the wildfire analogy is still apt. A little case here and a little case there can be like an ember on dry timber. And once the fire starts, it can get out of control very, very quickly. Each time someone travels to an area with high rates, that's a risk of introducing an ember into the dry timber of Santa Clara County.
Okay, we're going to go with Kit and Rob, and then we're going to go into our Spanish language statement. Kit?
Anything anybody here would like to say directly to the young people? I think you made reference to teens and some young adults where you're seeing more of the cases, right? Anything you want to say directly to them? Be it finger wagging or lecturing or pleading from your heart? Like, what do you want to say to them?
I think it's just important to know that this is a virus where 40% of people with infection have no symptoms. That's really important to know. Some people have to go out and work. Some young people have to go out and work. And we urge them to protect themselves with face coverings, with distancing, with everything that they can do. But there's no reason that we need to take a risk outside of essential work because that puts us all at risk of getting sick. So we just urge everyone to do everything that they can to keep themselves, their families, and their friends healthy and safe.
Cody, I'm curious of the concept of pandemic fatigue. Can you drill down on that a little bit? Does that just mean that if I'm just going to jump out of the car and pump gas for 2 minutes, I don't need my mask? Where does define that term, folks?
The question is pandemic fatigue. What do we mean by that? What we mean by pandemic fatigue is that all of us have been worrying about COVID for a very long time. We got a head start on worrying here in Santa Clara County, and we're learning. We're wearing masks. We're washing hands. We're not seeing friends. We're not seeing family, and it takes an extraordinary amount of effort to keep it up. And people are tired. We're here today to say, we hear you, we understand you're tired, and you still have to keep it up. You still have to keep it up. There is an end in sight. It's just not next month or the month after that. So please, please keep wearing your face covering. Keep staying at home to the greatest extent that you can. Keep your activities outdoors and keep your distance.
Thank you. Thank you, everyone. Thank you, Dr. Cody.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.